So what is ataxia? Coming to the clinical portion now. Taxis means order, taxonomy, ordering of animal species. Ataxia, when that order is disturbed. So we have where the movements no longer lack their normal fluidity, but it is broken up into small segments or components of individual movements. That's what happens when there is ataxia. So what controls it? Well, we need afferent signals coming in from the proprioceptive sensory apparatus. There's also the vestibular connections that bring in signals, and the cerebellar, as you have seen from the previous diagram, is the master integrator, a supercomputer, which controls a lot of the things that will enable the body to react to various different changes in the environment, from the labyrinthine, from the tactile, from the visual, we'll come to that later, and from the proprioceptive signals. So what happens when there is a loss of proprioception, and how does it happen? It can happen from problems in the nerve roots, from the nerves, from the dorsal root ganglia, from the spinal roots, and from the dorsal columns. So the person will be having a high steppage gait because the person doesn't know how high to lift the foot because the proprioceptive signals are not coming efficiently from the joints, from the muscles. We have pseudoathetosis. When the person spreads the fingers out into the open, there is a constant writhing movements of the fingers going on constantly because the signals from the fingers do not reach the cerebellum and go back to the fingers efficiently. So there's a constant groping around that takes place. On examination, we are well aware that if you have a peripheral neuropathy or a ganglionopathy or a posterior column disorder, the distal reflexes are all lost. There is vibration sense and joint position sense loss. There's a tremendous amount of visual inputs that controls everything. When that's lost, the patient falls off. But there is no dysarthria, difficulty in speaking, or nystagmus, because these have to do with other systems which are not affected in sensory ataxia. We mustn't forget the small receptors in the skin that control all the afferent signals that go up through the nerve roots. So any disorder affecting these structures, the Pacinian corpuscles, the Meissner's corpuscles, the Merkel's disc, and the Ruffini's corpuscles, they all control the afferent processes. So if those are disturbed, we'll immediately have difficulty in proprioception as well.